The secret to avoiding a knee replacement is early intervention. Good morning. I am Dr. Manabendra Basu Mallick. I am an orthopedic surgeon. I specialize in knee preservation. I mostly work with knee reconstructions, knee salvage, and rarely, if required, if everything fails, then a knee replacement. I work with Apollo Hospitals, Kolkata, and I have been in this profession for last 23 years, of which the last 10 years is dedicated exclusively to knee salvage surgery. Today, we are going to pick up on the commonest 10 questions that I face for my patients who come to me with knee problems or come to me pre-decided that they want to have a knee replacement surgery. The reason why some of us are going to need knee replacement is a end stage damage to the knee. Now, we need to find why the knee gets damaged. There are so many reasons why a knee gets damaged, like meniscus injury, cartilage injury, ligament injury, wear and tear, inflammation, deformities, and each of these things, if tackled early on in the disease phase, can actually preserve the knee and prevent the knee going from terminal damage and end up with a knee replacement. So the whole focus of avoiding knee replacement is looking at the reason behind knee degeneration and correcting the knee degeneration before degeneration happens. So how does a meniscus damage lead to arthritis of the knee? The meniscus is a cushion in the knee like tires in your car's wheels, and it's unique to the knee. It's not present in any other joint of the body. So because knee being such a complex joint, it needs special cushions to function well, and meniscus is this cushion. Once you have damaged your meniscus, the cushion effect is gone. It's like riding on flat tires. You can keep on carrying on with it, but it's eventually going to damage your wheel and your car finally. Similarly, once your meniscus is damaged in the knee is going to suffer damages and going to degenerate and end up with an arthritis. Now, trying to understand, are cartilages and meniscus the same thing or are they different? Cartilage is a protective covering over the bones inside your knee joint or any other joint. It's present in all your joints. It just covers the bone inside your joint. It's like a Teflon coating on your car, which prevents the car from getting scratched, protects the car's paint, keeps the car shiny. Similarly, the cartilage inside your joints, whether it's knee joint, hip joint, any other joint, keeps the bones healthy. Meniscus is a special cushion present only in the knee, so it's not present in other joints. So they are vastly different, and the function that they perform is also slightly different, as in your cartilage protects the bones and your meniscus protects the knee. So how does ligaments contribute to joint health? Ligaments are like tie ropes which keeps your knee stable, which keeps your bones close to each other, allows limited but controlled mobility. Once you have lost your ligaments, it's like riding on wobbly tires. You can again keep on riding with limitations, but over the end the tire is going to wear out. Similarly, if you lose your ligaments, your joint will become loose, and then it's going to have an altered biomechanics, more wear and tear, and end up in an arthritic joint. So the trick to avoid an arthritic joint after a ligament injury is to get your ligament fixed, get back your normal biomechanics, and have a healthy joint forever. So what can I do if I already have arthritis in the knee? What we see as arthritis on X-ray is a very common feature of aging, and everybody beyond the age of 40 or 45 is going to have some arthritis which will show up on X-ray, but this need not be symptomatic. Most people with limited amount of arthritis in the knee or degeneration in the knee beyond 45 years of age are going to live a pain-free, healthy life as long as they can control the movement that they do, have strong bones by either medicines or by having enough physical activity, and going to have strong muscles by the form of exercise, need to control their body weight. So limited arthritis is not an indication for needing a knee replacement in the near future. So what to do if you have painful arthritis of the knee? As again we have said in the past, that the pain in an arthritic joint might be coming from the meniscus, from the cartilage, from loose bodies in the joint, excess fluid in the joint, inflammation in the joint, uric acid collection in the joint. So even if you have a painful arthritis and we can isolate the pain behind the arthritis and we can manage that pain behind the arthritis, we can still control your pain, give you a good fluid knee joint, have a good quality of life and avoid knee replacement. So not that all arthritic painful knees are going to end up with a knee replacement. It of course needs addressing, needs to be intervened, needs correction for the cause behind the pain, but it's not necessarily an indication for knee replacement. So what can I do if my knees have become deformed and painful? Now, deformity in the knee joint itself causes localized overload, increased pain in the joint. So it's not necessarily arthritis per se, but it's a precursor to arthritis. So any deformed joint needs to be corrected, the deformity needs to be corrected, the knee needs to be straight again, realignment procedures has to be done for that joint load to be equally spread out throughout the joint. By this, you can completely cure the pain, if not forever, for a significant period of time. Secondarily, you can have an improved walk, gait, sports, activities of daily living. Third, it can protect the knee joint structures which would have otherwise got damaged because of the deformed structure of the knee joint. Does taking chondroitin glucosamine tablets or injecting jelly into the joints help? Is it going to give me a healthy knee? This is a massive myth propagated by pharmacological companies. The jelly inside the joint is a lubricant and it's God's gift. It can never be reproduced, has yet not been replaced. So the whole nutrition of the cartilage comes from the jelly, the lubricant that's inside our joint. So whatever we buy off the shelf is so dubious that it's not even recognized as a drug. It's being sold as a nutritional supplement. Even the jelly that is injected into the joint can only help you for a month or so because it doesn't give nutrition to the cartilage in the joint. It's never going to cause healing of the joint. It's never going to give you a long-term benefit. So take them, accept them with significant amount of cynicism. I would strongly recommend most people to stay away from them. So why does knee arthritis progress over time? Why is it getting worse over time? Now all the structures in the knee joint, the ligament, the bones, the muscles, the cartilages, all of them work in unison to give you a perfectly working machine. Once any one of them, either the meniscus or the cartilage or the ligaments or the bones, any of them goes haywire, it's going to negatively affect the other structures. So it ends up with a domino effect, which each structure is followed by damage to the other structure, by damage to the next structure. So over a period of time, a small damage gets amplified, magnified, ends up with the arthritis, which is not correctable thereafter. So the trick to avoid an arthritic knee, to progression of damage, is an early intervention. Go in and fix minor problems as and when they arise, so that you don't get a arthritis bad enough for a knee replacement. So when do I actually need a knee replacement? If you are not taking care of your small tire punctures, your car is going to wear out, your wheel is going to wear out, the tire is going to go, and that's going to completely damage the knee. So when the knee is so badly damaged that all structures are gone, none of them are in a correctable position, then you end up with what we call a terminal arthritis or end stage arthritis, where all components of the knee joints are damaged. This is the scenario where knee replacement remains your best bet and as yet remains one of the most successful knee surgeries, giving you long-term knee benefit. But then the conditions and the situation should not be allowed to arrive in the first place. You should take care of your knee problems early on, get minor problems fixed, so that you don't end up with a major problem later on in life.